Okay. Hello, everybody. Good afternoon and welcome to this event organised by the European Public Health Alliance. We're here to discuss an important issue about the air pollution that comes from gas cooking appliances. For anyone new to this topic, air pollution is something that most people associate with being outside, but sadly there are significant sources of pollution from within our own homes. And gas cooking has been found to release harmful pollutants into our homes. And in fact, so much so that they exceed the guidelines that have been set by the World Health Organization. These pollutants, pollutants like nitrogen dioxide, they have been linked to a range of health conditions and impacts, including childhood asthma. This is quite a live topic. So there is a recent study from CLASP that we are going to hear more about in a moment, and a European Commission eco-design consultation forum happening early next year, with the potential for air pollution to be a topic for discussion. So in this context today, we are here to deepen our understanding of the topic and reflect on what we as a public health community can do next. So my name is Richard Doughty. I'm an independent policy and communications consultant for public interest organisations, and I will be moderating today's event. We have participants joining from across Europe today. We're really happy to have you all with us. In a moment, we're going to hear from colleagues from IFA, from CLASP, and some other excellent speakers. But first, I want you to know how you can get the most out of this event. So this event is being recorded. The video will be available afterwards on IFA's YouTube channel and the event webpage. And there's going to be lots of opportunities for you to share questions with our speakers. At the bottom of your Zoom window, you will see a Q&A, a question and answer box, where you can submit any questions you have. And you can join the discussion on IFA's social media accounts, including on X, formerly Twitter, at EPHA_EU. And you can use the hashtag #CleanCooking. So, we have some really great speakers with us today. In a moment, we will hear from Christina Prikop, who is IFA's policy manager looking at air pollution. Then we're going to hear from Nicole Kearney, the Europe director for CLASP, who is going to discuss some of the main findings from their recent study into the impact of gas cooking on indoor air quality. And then we will have a panel discussion with contributions from experts and specialists to put this issue in context, including Dr. Laura Reali, a pediatrician and president of the European Confederation of Primary Care Pediatricians, Armando Ruiz, vice president of the European Federation of Allergies and Airways and international manager at the Spanish Federation of Allergy and Airways Diseases Patients Associations, and Dr. Joana Maria Delgado Saboret, who is head of the European Health Research Laboratory at La Universitat Jaume I in the north of the Valencian community. But first, it is my great pleasure to introduce IFA's policy manager for air pollution, Christina Prikop, to begin our discussion. So IFA is an international not-for-profit association established to advocate for the protection and improvement of public health in Europe, both via health policies and across all other relevant policies, areas that have an impact on health. Christina's work on clean air focuses on the health and climate co-benefits of a just transition to clean heating and cooking. She holds a bachelor's in politics and international studies from the University of Warwick and a master's in political science from Central European University. Christina, thank you very much for joining us today. The floor is yours.
Thank you, Richard. Thank you very much for the introduction. Hello, everyone. Thank you for joining us. It is really great to be able to have this conversation today with you. And I am personally very excited to be able to share the manifesto that we have been working on to try to draw attention to this health risk related to gas cooking inside many homes in Europe. And we are going to try and make a case for the importance of this manifesto with my short presentation today, which I have structured in 3 parts. So I'll be talking to the issue, the policy opportunity that we currently have, and the IFA call for action. And as Richard was alluding to at the beginning, air pollution is largely recognized as the top environmental health risk that we are currently facing in Europe. It is linked to hundreds of thousands of premature deaths yearly on our continent, and we do have a dedicated legislative framework to deal with outdoor air pollution. However, many studies have found that we have higher air pollution concentrations inside our homes and in indoor environments than outdoors, and that these levels of pollution cause damage to our cardiovascular and respiratory health. And the highest authority, the WHO itself, has recognized in a document over 2 decades ago the right of people to have healthy indoor air. And yet, a cohesive framework at the EU level is yet to emerge for indoor air quality. And now this is a very complex issue that is related to ventilation, that is related to different sources inside our homes, from gas appliances to candles that people may be burning inside their homes to other sources. But we want to stress the importance of addressing the source of pollution as the priority way of addressing this problem. And I will be speaking to the problem of cooking with gas as a public health risk. We know that cooking with gas releases pollutants inside over 144 million European homes, and it releases pollutants such as nitrogen dioxide, carbon monoxide, and ultrafine particles. You'll see in that illustration that these impact the nervous, respiratory, and circulatory systems of both adults and children. I won't go into the details necessarily, but it is just to say and illustrate the fact that this really impacts the entire human body. And I'll zoom in just for a second on nitrogen dioxide to say that it causes a range of harmful impacts on the lungs, including increased inflammation of the airways, coughing and wheezing, reduced lung function, and increased asthma attacks, in particular in children. And on asthma, there's also, we were talking about pollutants, but also when looking at gas cooking as a risk factor, we see the WHO guidelines for indoor air quality on selected pollutants from 2010 that already recognized the fact that children in homes with gas cooking have a 20% increased risk of lower respiratory illnesses. And a few years later, we have a peer-reviewed meta-analysis that included studies from across the globe. And it found that really no matter the region, with very little variations, children who live in a home with gas cooking have increased risks of experiencing current asthma and of experiencing lifetime asthma. And that percentage increase is significant, and it's 42% and 24% respectively. That is the body of existing literature that we have synthesized in a report, a CLASP IFA report, together with our partner at CLASP, who are also with us today. And in addition to the existing evidence base, the report also mentioned and brought to light a new study done by an independent research institution, TNO, in the Netherlands, that used the concept of population attributable fraction in order to estimate what is the current childhood asthma burden in Europe that is linked to gas cooking. So this path is the reduction in population disease or mortality that we would observe had those people not been exposed to the risk that we're considering. And what we found for gas cooking in Europe is that the average EU path for current childhood asthma associated with gas cooking is 12%. And that is very similar to recent findings in the US. And this means that over 700,000 children in the EU would not have been currently suffering from asthma symptoms had they not been exposed to gas cooking in their houses. And there's been some follow-up work and Nicole will be talking to this later on. But I'll go to my second part of the presentation, which talks about the policy opportunity that we currently have, which is related to EU product policy. And this may be a bit unusual for the health community, but the EU has eco-design and eco-labeling, which are the cornerstones of our sustainable product policy. So eco-design removes from the market the least efficient appliances, and eco-labeling is the tool that pulls consumers towards the more efficient and the best products on the market, essentially. But the point that I want to make is that these are not, though they are technical conversations, they are not only conversations about innovation and about the appliance itself or about the industry. It is also policy discussions that have a real impact on the health of the people who use these appliances, and therefore it is important for the health and the medical community to engage in these conversations, although it might not be our most natural comfort zone, so to speak. And in fact, it is recognized that these policies have the potential to reduce air pollution. That is included in the Commission's working plan for 2022-2024. There are policy frameworks specific to different appliances, and for space heaters, for example, we already see limits for nitrogen oxides. And there is an ongoing conversation and revision related to solid fuel boilers, where in the current consultation, we see a note that eco-design and energy labeling requirements should not only improve the energy efficiency of products, but also reduce pollutant emissions. Therefore, the potential is clearly there, and we have an ongoing open revision of eco-design and energy labeling for cooking appliances. And in the preparatory study that was published about a year ago, cooking was recognized as a significant source of indoor pollutants. And the study even highlights gas burning specifically as a health issue, being related to additional pollutants being emitted. However, the only proposed solution is disappointingly related to mitigation through ventilation. And ventilation is definitely and unquestionably important whenever we do cook, but this is not the robust solution. We are aiming to address the source of pollution and the appliance itself first and foremost. So with that in mind, and in that context comes our manifesto that is addressed to the medical and health community, that essentially summarizes everything that I've been talking about, and then features three prominent asks. We would like to see strict nitrogen dioxide emission limits and ultimately have a phase out on the sale of gas cooking appliances. We are also asking for support for an equitable green transition because health equity is something that is very important throughout the work that we do at IFA. And while the costs for electric appliances are getting lower, and while there are other costs that we may want to consider, such as health costs that people don't necessarily normally think of when buying appliances, there is an upfront cost for which some groups of the population might need extra support. And finally, we are asking for more education and more awareness for medical professionals, for consumers, for patients, for people in general, because this is really not an issue that is as well known as we argue that it should be. And it is important that everyone concerned is aware, and everyone concerned is all of us. And so what we are asking with today's webinar is that you please consider signing the manifesto. This is open to individual and institutional endorsements. When you fill out the form there's also an opportunity to share a quote, a reason why you personally are interested in supporting this. And we also ask that you please share this further with your network. And if you'd like to be more actively engaged, please do reach out to us and to myself. There's my email address there. And that was my presentation. Thank you very much.
Christina, thank you so much for setting the scene so well. It is very striking when we think that this is potentially 700,000 children who we could put into a better position in terms of alleviating them or supporting to have a reduced impact from childhood asthma. And particularly what you say about addressing the source of pollution is the most robust solution, and that ventilation is really a mitigation effort while we make this green and equitable transition. Christina, thank you so much for that. We're now going to hear about a study that was launched less than 2 weeks ago, and we're going to hear from Nicole Kearney. Nicole is the Europe Director for CLASP. CLASP is an international non-profit organization working to implement energy efficiency standards and labels. Nicole has been part of CLASP's climate team for over a decade now, and previously worked on European eco-design and energy labelling, product policies and compliance for the UK government. Nicole, very happy that you're here with us today. I'll hand the floor over to you.
Thanks so much, Richard. Thank you for that great introduction and context, Christina. I think you've really explained the issue, and my goal today is to really share the realities of the situation and yeah, to share with you the findings from our study. So thanks to everybody as well for joining today. Great to be bringing this to the forefront. So just a few more additional words about CLASP to explain why we're working on the topic of cooking appliances and that health aspect. So we're focused on improving the energy and environmental performance of products, ensuring they're affordable, low impact and high quality to ensure they're essentially better for the people and the planet. And in Europe, we're doing so by supporting these ambitious product policy standards in the EU and in the UK. So as Christina has already made very clear, it's well established that gas cooking is a key source of indoor air pollution, specifically nitrogen dioxide. Despite this existing research, much of the public just isn't aware of this invisible air pollution in their home. So this year, we set out to understand the severity of the pollution caused by gas cooking, with a goal to raise awareness and identify strategies to tackle the issue. Building on our joint report with IFA earlier this year, CLASP partnered with the Dutch Research Institute TNO and a market research and insight agency, Opinium, to conduct a Europe-wide study to measure air pollution from gas cooking in people's kitchens and their homes. So we sent air quality measurement equipment to around 250 gas and electric cooking homes in 7 countries. That's the Netherlands, Italy, Spain, France, Slovakia, Romania, and the UK. And we did so to determine just how much pollution is emitted into the home whenever people turn on their hob or oven. The countries we selected were based on the high percentage of gas cooking homes and the number of children that could experience asthma symptoms linked to gas cooking. Sensors were set up in people's kitchens, their living room and bedroom for 13 days to understand whether this pollution spreads through the home. We use both active and passive sensors. So our active sensors recorded minute-by-minute data in the kitchen, and the passive sensors that were used in the kitchen, the living room, and the bedroom recorded an average level of pollution over those 13 days. We also placed a passive sensor outdoors to understand whether outdoor air pollution could impact levels indoors. So here's what we found. First of all, the field study confirmed that nitrogen dioxide is emitted by the gas cooking appliance, whereas particulate matter, PM2.5, is emitted by the act of frying or cooking foods. We found very high levels of PM2.5 in both gas and electric homes, whereas NO2 exceedances were captured primarily in those homes cooking with gas, but also in some electric cooking homes in areas with higher outdoor air pollution. So diving into a bit more detail, across all the countries, we found that gas cooking households experienced significantly higher levels of NO2 when their gas-fueled appliances were on. On average, pollution was almost twice as high around the home compared to households cooking with electric appliances. So on this slide, you can see a comparison of the average NO2 concentrations we found in both electric and gas cooking homes in all countries. On the left, in the electric cooking homes, the highest levels of NO2 pollution were found outdoors, and that's shown here with the blue lines. We found the highest levels in Romania, with NO2 concentrations averaging around 28.5 micrograms per cubic meter. On the right, in the gas cooking homes, the highest levels of NO2 pollution were found indoors, and that you can see here on the red lines. The highest pollution levels were found in Italy, Spain, and Romania at just under 33 micrograms per cubic meter, so even higher than the levels we found outdoors with the electric cooking homes. So just to put this into perspective, we hear a lot about the health risks of outdoor air pollution, and we expect to go home and find some respite indoors. But as soon as you turn on your hob or oven, indoor pollution levels can get much worse than they are outdoors. The opposite is true in electric cooking homes, where the greatest risk is that air pollution from the street infiltrates indoors. So here we can see a clear comparison of NO2 pollution levels throughout the home. These were the average concentrations that we found across Europe. In every single room across the home, those that have a gas hob or oven also had nearly twice the amount of NO2 concentrations. We also found many more homes with gas ovens in the UK, that pollution levels increased significantly when the gas oven was turned on, and those levels sometimes spiked so high they went beyond the maximum reading of the sensor. But unfortunately, there are no European mandatory indoor air pollution standards or benchmarks. So we compared our findings to mandatory outdoor air quality standards in both the EU and the UK. And we also used the WHO's air quality guidelines that define acceptable levels of air pollution for both indoors and outdoors. So extrapolating to a year, the results show that around a quarter of European homes that cook with gas reached EU and UK hourly NO2 limits for outside air quality. People can expect to see more immediate health impacts once those hourly limits are breached. Specifically, asthmatic individuals may experience an onset of symptoms such as coughing, wheezing, or headaches, whereas no homes using electric hobs or ovens experience these breaches. Over 57% of European gas cooking homes exceeded the WHO's daily guidelines of 25 micrograms per cubic meter. And added together, the WHO daily limit was breached for around 3.25 days over the 13-day testing period on average. So you'll see from the European findings that a few electric cooking households also exceed the WHO's daily guidelines. This was in the Netherlands and Spain. And for those homes, we found that they had very high outdoor pollution readings, which must have infiltrated indoors into their kitchens. So governments, both local and national, have to take action when outdoor pollution levels are this high. We've seen, for example, the introduction of low emission zones and fuel emission requirements for cars, but nothing is done to address the air pollution from our gas cookers indoors. We also looked at the impact that cooker hoods had on air quality. As Christina said, this is proposed as a solution often to mitigate air pollution from cooking. So we analyzed data for 3 different types of homes: those that had a ducted hood, where air is extracted outdoors; those with recirculating hoods that clean odors from the air but move it back into the room. And these are often found in apartments. And we also looked at homes with no cooker hoods. And the results were somewhat surprising. We found that homes with cooker hoods, both externally ducted and recirculating, had little impact on improving air quality. So in this graph, you can see the 3 different ventilation types and how little the NO2 concentrations differ between each room. And what's notable is that homes with recirculating hoods, which are not efficient, show even higher levels of NO2 than those homes with no cooker hoods. We found the same for PM 2.5 levels, which, as I mentioned before, are emitted through the cooking process rather than the appliance. The recirculation hood findings aren't that shocking, as prior research already has demonstrated the inefficiency of the particular technology. But cooker hoods that extract air to the outside have been known to help reduce pollution from cooking and should have had more of an impact. So what this tells us is that those hoods are either not capturing pollutants effectively or they're not being used as intended. So as you can see on this next graph, those conclusions are backed up by some findings from a consumer survey we ran earlier this year, where only a small proportion of respondents said they actually turn on their cooker hoods to reduce indoor air pollution. And mostly people tend to turn on their cooker hoods to help reduce smoke and get rid of cooking smells. And they sometimes turn them off as soon as possible because they can be quite loud. So, what this tells us is that while proper ventilation is important, it is not a solution to gas cooking pollution in and of itself. So all of this household monitoring data is incredibly important. I just want to note that in that same consumer survey conducted earlier this year, we also found that around 61% of respondents would consider getting rid of their gas cooking appliance if they knew there were health implications. But only around 41% of respondents actually identified a link between gas cooking and health issues. So getting this air pollution data out there is really critical. You can read more about the field study, the consumer survey, and the first reports that Christina talked to, that we co-authored with IFA. You can find these all on our website, and we'll have more coming out in the new year as well. So keep an eye out, and let's try and get the message out. Thank you very much.
Nicole, thank you so much for providing that summary of this really striking piece of research. I find it very striking how clear-cut these findings are. I think it's especially striking that the NO2, it doesn't stay in the kitchen. It's everywhere in the home, including our bedrooms and where we're sleeping. And I think I find especially striking what you say, that governments, because of the WHO guidelines and various other measures, if the levels were this high outdoors, governments are required to take action, but because they're indoors, they're not yet required to do so. So what I would like to do, if it's all right, is I'd like to take a moment to have some questions from the audience. So if you have any questions about either the manifesto or this study from CLASP, please write them in the Q&A box at the bottom of your Zoom window. We will answer a couple of them now before we go into our panel discussion. While those are being written, I would just like to sort of begin by asking Christina, if that's okay. Christina, we've seen a really wide range of reactions from the public to this topic. So what do you think is at the root of public concern on this topic? And particularly, what steps do you think policymakers should be taking to reassure the public?
Thank you for the question, Richard. I think this is a personal topic to a lot of people. We've seen this being the topic that maybe generates the most interest on our social media channels outside of what you'd consider the general Brussels bubble usual suspects. So this really is an issue that resonates with people. And as Nicole was saying as well, your home environment is where you normally feel safe. And you cook in an act of love and caring for your family. And therefore, being told that this might actually lead to negative health impacts is really something that I think a lot of people, really feel deeply. And I think it's important that in general, we are reassured that EU policies do consider the health impacts very seriously, even if it's not a health-specific policy that we're talking about. And so there are a number of different steps that can be taken, from informing people about the levels of pollution that they might expect when they're using a gas appliance, to a progressive phase out of the gas stove that we are hoping for eventually.
Absolutely. Thank you for that. Nicole, just quickly, I wanted to ask you, I mean, firstly, it would be really interesting to hear how this study has been received. What are the reactions have been? Have you heard anything yet from decision makers or the general public? And really, who do you think are the most important people that you would like to be hearing these findings?
Thanks, Richard. Yeah, of course. I can say that our report has been picked up by media across Europe. And we've also seen some media pickup in other countries around the world as well, including in India. We're still kind of going through all of the data and analyzing the media pickup. But in general, we've seen fairly positive and neutral pickup by the press, including in newspapers, TV, radio. I think more so in some countries than others. But we've even seen some positive takes on this work from publications that tend to be a bit more critical of these types of issues. So it's really great to see that people are taking this seriously, that they're getting the message out and communicating it appropriately. We have already heard some interest from some decision makers, but it's been 2 weeks, so we have yet to kind of explore this in a bit more detail. But we're really looking forward to picking up the issue with them and with other stakeholders now that this information, this data is more is publicly available. We're really hopeful that we have got the message out and that many different stakeholders are now thinking about the implications of using gas to cook in their kitchens. I think it's great that we're all together here on a webinar with health practitioners and organizations, because they are really a key stakeholder in getting the message out, in raising the fact that gas cooking does impact our health. For those individuals, for example, with asthma, that they may consider this as a potential contributor to their symptoms. But of course, I think it's really important that decision makers are hearing this information and hearing from other stakeholders in the sector how important it is to address it for the individuals. So, yeah, thanks.
Thank you for that overview. I'd like to go to a question from Mila Paspa-Lanova. My apologies, Mila. Mila was asking about the relationship between the size of the kitchen where the gas stove is used and asthma, and particularly if we have any cross-country data. What I think is probably clear, certainly from the class study, is that the size of the kitchen may not be so relevant, considering that NO2 particularly, it just stays around the whole house, especially. I wonder, Christina or Nicole, would one of you be willing to share a little bit in response to that?
Yeah, I'm happy to chime in here. Also having some personal experience with measuring the pollution in my own home. So as you said, the report didn't find a strong correlation between the size of the kitchen and the pollution levels. We are going to be doing some more analysis on ventilation, kitchen sizes, other issues as well, to be published in a peer review paper next year. But I can just confirm this. I had a team of researchers looking at the air pollution in my home from my gas hob, which I'm looking to convert to induction. I have a relatively large open plan kitchen, and the pollution levels for NO2 were incredibly high when they put the hob on, say, in a situation as if I were cooking a stew. And they also monitored the air pollution levels in my children's playroom, which is a ways away from the kitchen. And after about like an hour or so, even that was the same as if I was standing directly over the hob itself. So whether your kitchen is small, whether your kitchen is large, this air pollution is still an issue and needs to be addressed.
Thank you, Christina.
Yeah, no, well, thank you, first of all, Nicole, for sharing that. And I think just to kind of also touch upon another question in the chat a little bit and reinforce the point that we've seen this kind of link with childhood asthma across the globe and in different kind of contexts where you might argue that we have different building codes and you know, all those variables do not, from the data that we've had, do not seem to impact all that much that correlation and that relationship that does exist between having a gas stove in your house and the risk of experiencing childhood asthma. Yeah.
Thank you. Christina, just staying with you for a moment, we've had a question from Kirsten Sirk, who was asking about, to understand a little bit more about the impact on adults and particularly consequences for the respiratory system. I was wondering if you would be able to share a little bit more. You mentioned it briefly in your presentation, but some of the respiratory impact for adults of NO2 and gas cooking.
Yes. No, we know that there is no safe level of air pollution. So while we see higher impacts on children because they have higher breathing rates, for example, and they are more susceptible to air pollution because their immune system hasn't developed yet fully, and all of that, we also see impacts on adults from NO2 pollution that is above WHO guideline limits. And yes, there is a list of that includes increased inflammation of the airways and experiencing coughing and wheezing, and all of that is also linked with increased health costs and health-related costs, so hospitalization, medication, all of that is something that we haven't really fully explored here, but is a cost that is oftentimes overlooked when we think about the costs that we incur when we buy a new appliance, for example, or in any sort of economic analysis.
The economics of this are going to be very interesting. This sort of this win-win-win concept that governments will save money on their health bills, people will be healthier, and of course there'll be fewer greenhouse gas emissions, of course, by moving to electric heating, which has the greater potential for coming from more renewable sources. Nicole, Christina, thank you very much for presenting the study and the manifesto and for answering questions. We're going to, I hope you will stay with us. I'd like to invite our other panelists to join us now to open this discussion out. What I'd like to do is to introduce our panelists one at a time, and we want to give them a few minutes to share their thoughts and insights for our discussion today, and then we will take further questions from the audience. So please remember to submit any questions you have for the panel using the Q&A box at the bottom of the Zoom window. We would love to hear them. We will answer as many as we can. I'd like to begin, if that's all right, with Dr. Laura Reali. Laura has been a primary care pediatrician for more than 35 years. She has published more than 50 scientific publications and has authored and edited several books on pediatric primary care, environment-related child diseases, and medical training. She's currently the president of the European Confederation of Primary Care Pediatricians, and she is a member of the Italian National Board of ISDE. Laura, thank you so much for being with us today. I wanted to ask you, from your experience as a pediatrician, what could you tell us about how environmental determinants of health, such as air quality and indoor air quality, how are those being addressed in practice, and what are those discussions with patients like?
Well, thank you for this very nice question and so pleasant presentation. Thank you so much. I'm a member of the European Academy of Pediatrics too for the environment problems. What I can say, in the past, pediatricians were not accustomed to addressing the environmental determinants of health in their professional practice with patients. It was out of our competencies. This topic was generally excluded from the pediatric specialization curricula. However, as environmental issues increase their negative effects on children's health, there has been a gradual shift, even though there is still room for improvement. And Italian researchers like Francesco Forastiere was one of the first that discovered the importance of the pollution of the environment for children's health. But now we know very well that, for example, the indoor environmental quality, including the use of cooling cars, can have significant impacts on children's health. And we speak about this with our children and with the parents during our veterinary well child checks. Personally, I dedicate time during the periodic well child health assessments to inquire about how my patients spend their time at home and outdoor, in the kitchen, out of the kitchen during her task or his task, for example. I try to explain them that the quality of the indoor environment is generally inferior to the outdoor environment, as pollutants from outdoors contribute to those that are present indoors, and they can not only add, but they can interfere. I mean that, for example, particulate matter 2.5 can have adherent viruses, bacteria, pollen, and the children are able to inspire them, and dioxide nitrogen too. This is very problematic for children lungs. And moreover, consequently, the notion of keeping children at home to protect them from the effect of the external environment, pollution, is not advisable, because it's preferable to let children spend time outdoors, preferably in green and wooded areas where the air quality is undoubtedly better. Environmental issues can make education and awareness, then can make assessment and screening just on the environmental behavior, prevention and intervention with information, as you have just told, and referrals and collaborations in case of problems evidenced during this health check visits. And this is what we can do, of course.
Laura, thank you so much for that. Yeah, I think it's often something that comes up regularly with medical practitioners in the public health space, which is giving our patients some agency, some control, the feeling that they can do something, and the advice here that ventilation is a useful, helpful step you can take to reduce the impact. Absolutely. Thank you. I'd like to introduce Armando. Armando Ruiz is Vice President of IFA, the European Federation of Allergies and Airways, and International Manager for FENAIR, which is the Spanish Federation of Allergy and Airway Disease Patients Associations. He works to shorten the gap between innovation, medical assistance, and the daily lives of patients. Armando, thank you so much for joining us today. It'd be interesting to hear from you, among patients, how well understood is the connection between gas cooking and conditions like asthma? And what has been your experience of working with patients and stakeholders on these topics?
Good afternoon, everyone. Thank you to invite us, and congratulations to Christina and all the great work that you are doing. FENAIR, the Spanish Federation, we are working on the topic on air quality and pollution, and also indoor air quality for a long time. Really, we have a fantastic guide in Spanish in our website that I invite you that you can take a look. Really, it's true that climate change in general, the concept, is something that the general population is aware of. Also about pollution, but much less when we talk about indoor air quality, in general, indoor air quality. So the gas cooking issue is unknown in the patient community, but also in the other many stakeholders, also in the doctors. It's not only a lack of knowledge of the implications of gas cooking for asthma or other respiratory diseases. It's also a lack of knowledge of all the factors around that affect the health related with the quality of the air at home. We saw now, Christina showed it so well, that there are scientific evidence that is showing the impact on respiratory patients, especially in children with asthma or patients with COPD. This large population, the number of children in Spain with asthma symptoms due to cooking gas is estimated around 120,000 children. So related with your question, also in my personal experience when engaging on this topic with the stakeholders really has been impressive. In the Federation, we are so happy to see how especially doctors are taking this topic. They are really willing to participate and to work on this topic. Despite really that is, we have an innovative approach to the topic, I really can see that is an issue that if we put on the table and we continue to working hard and well, it's something that they can join us and really trying to find ways or solutions for families that they are currently cooking with gas at home. Yeah.
Armando, thank you. It's very reassuring to hear that a lot of the engagement you've been having so far has been optimistic. It's been positive that there are people who are willing to engage on this topic. That's very reassuring to hear. I'd like to bring in our third panelist, who is Dr. Joana Maria Delgado Saborit. Joana Maria is a researcher and head of the Environmental Health Research Laboratory at La Universitat Jaume I in the north of the Valencia community. Her research focuses on understanding the relationship between environmental factors and health and well-being to inform environmental health policies. Joana Maria, thank you so much for being here. It'll be interesting to hear from you. The lack of policy action on this topic so far is sometimes attributed to a lack of Europe-specific data. Do you feel that that situation is changing? Do you think that the available evidence is compelling enough to require regulation and government action?
Thank you very much for inviting me and for all the panel that you have prepared. To be fair, it has been quite a while, different pieces of research that have been appearing at the European level. So, for instance, in 2012, at the beginning of the 2010s, we have sensors that we were able to use them, and we were doing a field sampling campaign in Birmingham, where I was working previously, and we were monitoring in 16 houses, 45 different events, and because of those sensors were able to give us real-time information, and the subjects that they were involved in the study, they were telling us all their activities, we could easily see that when they were cooking, the peaks of exposure to NO2 and other pollutants were clearly increasing. So that was when we were able to really match that the high levels of concentrations that were associated with NO2 in houses, that they were cooking with gas appliances, or that they were using other type of gas appliances, maybe for heating, that they were having real high concentrations, peak concentrations, because of the gas cooking. But before that, we have had, like, every 5 to 10 years, we have really high studies in Spain, Switzerland, in the UK, Finland, that have involved between 3,000 subjects, participants, even up to 1,400 participants. And in the different studies, and we can have up to 5 different studies in the last 30 years, we have constantly seen that those subjects that live in houses that cook with gas, they have really higher concentrations than their counterparts that they use electric appliances for cooking. So this is something that research scientists have known. We have information using passive samplers, which is a different technology than the technologies that we have now that are able to really see those peaks when you are cooking. But the information that we are getting from all the different studies that we have at the European level is the same, that gas cooking really increases our exposure to NO2.
Thank you, Joanna Maria. Yes, I think certainly from what we've seen from the presentation from class earlier, and for some of the people who have already seen some of the other studies, is how consistent the data is being on this point, and how much this is absolutely an important topic that is worth addressing. I'd like to invite our audience to contribute any questions that you may have for our panelists. Not just for Laura, Joanna Maria, and Armando, but also for Nicole and Christina. So please use the Q&A function at the bottom of the Zoom window to submit any questions you have. We will get through as many as we can in the time that we have left together. If it's okay, I would like to jump in with a quick question of my own. There is an element to this topic which is worth careful consideration, which is to do with equity. And particularly how different groups of people are going to be disproportionately impacted by the health impacts of indoor air quality than others. So Armando, I was wondering if I could pick up with you. Knowing the evidence that respiratory disease patients, they have earlier and worse reactions when exposed to poor indoor air quality, but their ability to make individual level changes, especially when they are renters, is often limited. So how do you think we can best protect patients' health in that sort of context?
Yeah, that's what we are fighting every day in many topics. This question really doesn't have a simple and single answer. In my opinion, for sure, we have to demonstrate also some kind of economic impact, maybe probably some kind of social impact, more than the clinical aspect or the health impact in the patients. I mean, the exacerbation, for example, due to poor indoor air quality, really they are generating high healthcare costs in emergencies, hospital admissions, loss of work days, for example. Yeah, so I think that would be interesting to move also to this, not just the clinical aspect, also the economical and social aspects of the issue. My position in advocating for the allergic and respiratory community, really to best protect their health on this specific topic, I will say that I have 4 points. The first one is that we need to find a sustainable way to monitor the air quality at homes. We should position the topic in the media and in the medical community. We also need to solve the knowledge gap in the population, in the general population about the topic. And the most important for me, and for me is essential, is how we can support for mitigating the cost of switching to clean electric alternatives. Yeah, because really to make individual level changes, we have to motivate a segment of population that often has low income, and I think that health reasons usually are not enough. That's what I think.
Thank you, Armando. I think that's a very full and great overview as an answer. Thank you for that. I was wondering, there's been a couple of questions here about how comparing gas and electric homes with similar outdoor pollution levels, and also to do with individual household data in more detail, particularly relating to the CLASP study that's been published. Nicole, I was wondering whether you would be able to respond to those questions that have come in from our audience today.
Yes, thank you for those questions. I think we have, in terms of the individual data and how households compare with different pollution levels outdoors. This isn't specifically outlined in our report, but in our partners' scientific report from TNO, you can see a full overview of the individual households and their pollution levels indoors and outdoors. So that data is available. I can also share that we're going to be reviewing in even closer detail a lot of the individual characteristics of individual homes in this peer review paper that I mentioned earlier. We'll be working with Juana Maria on that paper as well, and looking to publish that by around May next year. So more on that to come.
Thank you so much, Nicole. Joanna Maria, I was wondering if I could ask you particularly. Knowing we've seen some renewed interest in the broader topic of indoor air quality recently. Notably, we've had the WHO in Europe organizing its first indoor air quality conference recently, but I think we know that indoor air quality is a complex topic. It will be interesting to hear from you about why we should tackle gas cooking specifically. And we've had a question from Nuria, which is, really, is this only gas cooking? Is this also gas heating? Or is this other appliances that are also worthy of consideration here?
So any appliance that uses gas as a combustion inside the house will be creating NO2. So normally you might have that if you have a domestic boiler, or if you have a stove for heating the space, or if you are using gas for cooking. The study that we have done that has been presented by Nicole, it was focused on houses that they were using gas cooking, or ovens also for gas cooking, and they were doing that comparison. We know definitely that the NO2 that we have indoors, which is a major component of the indoor air quality, comes a part of that will come from outdoors, that it will infiltrate indoors. So those for that we have all the regulations that control the outdoor air quality. But inside the houses, or inside the different buildings, what we also have to do is to control the indoor sources. And we know for sure that gas cooking is one of the major sources contributing to NO2 in our indoor environments. And not only that, is that it contributes to NO2 in the chronic effects. So in the long term, they raise average concentrations over the year, over the 24 hours, but also it increases with peak exposures the concentrations that we are breathing whilst we are cooking, or our children are in the kitchen whilst we are doing the cooking, or so on. So because we know that we have health effects associated with NO2, both at the short-term exposure and with, for instance, asthma exacerbation, that also increases our susceptibility for having respiratory diseases or for having infectious diseases and so on. But also we have it as the chronic exposure, so we might have more respiratory mortality, or all-cause mortality that is not accidental. We will have more visits to A&E. So we have both the high exposure, acute effects, and long-term exposure, chronic effects that we really should tackle. And we know that that source is increasing our concentrations in our houses. So I think that it's worth to invest in finding different solutions.
Thank you very much for that answer. Christina.
Yes, thank you, Richard. If I can jump in just for a moment on that question around cooking and heating, because in fact, we are indeed concerned about all the gas appliances in our houses. And a while ago, a couple of years ago, we did a study that essentially did what Armando was talking about just before, in terms of understanding the health-related societal costs that come from pollution from gas boilers. And for that, we considered outdoors pollutions, because boilers are normally vented to the outside, and we didn't at that time have data specifically and recent enough for European houses, but we knew the concentrations outdoors and the proportion that was attributable to heating. And at the time of the research, so before the current inflation and everything, that amounted to 3.5 billion euros per year in health-related costs for Europe because of the gas boilers that heat our houses. So just to say that that data is out there, and it's another issue that is in need of tackling.
Thank you for that context, Christina. Yeah, there is definitely an investment argument to be made in this topic, that the potential benefits, financial and economic benefits, may in some cases potentially outweigh the investment costs that will be needed to address, or at least in part address, some of these topics. Laura, I'd like to ask you a question, if that's all right. Knowing the evidence, the data, and from your own experience in practice, you were a signatory to the manifesto that Christina launched earlier. You signed both as an individual and also in the name of one of the organizations you represent, the European Academy of Pediatrics. I just wondered if you could tell us a little bit about why you think more broadly engaging and mobilizing the health and medical community towards action on this topic is important.
Thank you for this question too. Well, I signed the manifesto because I agree with the growing concern and evidence about the stoves and ovens potential health impacts, particularly on children. And, we must remember that lungs of the children are evolving. Lungs will be mature after the 15th year of age. Till that age, the evolution is growing and is very sensible to air pollution. And most of all, as I can say, the building of the lungs in the fetuses of the women that in pregnancy are cooking in the kitchen. They are the most sensible at all to the inhaling of the mother because the nitrogen dioxide is very, very lipophilic molecule. So it arrives immediately with the bloodstream in the fetus, and it is able to, in such a way, to damage the evolving lung of the fetus. So, as a pediatrician, I am very worried about these possibilities because, they are avoidable. So we can do something to reduce it. This is not only lighting or temperature or allergens. It's a mix of possible risks, and almost one of them we can avoid. Therefore, engaging and mobilizing the health and medical community towards political and policy engagement in improving the indoor environmental quality is crucial in my evidence. In my opinion, evidence are enough. We have to do something to move from this point. And as WHO defined in the first conference in 2005 with all the Ministry of Health about how we can improve children's health, well, pediatricians and medical professionals obviously can make education, can make information, can make advocacy to improve the possibility to avoid problems and risks for our children.
Thank you for sharing your motivations and your thoughts on that. Very appreciated. Just a reminder that you can ask questions to our panelists using the Q&A function at the bottom of the Zoom window. Please do submit your questions. They'll be really useful to hear. We've had a question from Laszlo, which raises the topic here about that it's not just, obviously, the gas cooking does not just take place in the home, it also takes place in public spaces and in workspaces. I think one of the most compelling arguments around the banning of smoking indoors in public spaces was the impact that it would have on workers and employees in spaces where they weren't choosing to be in that space necessarily. Do we think that there is a similar case to be made here? And for those of us who are more familiar with the data and the research in this space, has there been any research around the potential impact in occupational exposure to cooking with gas? I'll open that question out to anyone on our panel who would like to tackle that.
I can add some evidence to that. So there has been some research works. Some of them are coming from China, but we also have some others in Europe and in the States, where they have been measuring emissions, cooking different dishes, different types of cooking, and they see that they have higher concentrations for those cooks that they cook with gas appliances than with electrics. So definitely cooks and people that are in, for instance, in restaurants or that are in caterings, they would be more exposed to those. That's an occupational exposure for them, and hence there could be some regulations in that aspect. So there's some evidence that it's around, especially from cooking emissions. Yes.
Thank you, Joanna Maria. Christina.
And I think there's also another aspect to it. Not only emissions, but I think the studies also talk about temperature and the fact that their cookers are exposed to lower temperature or cooler temperatures, and the fact that the kitchens are less noisy and they're easier to clean. So there are a number of other co-benefits that are linked to health, but also well-being and comfort and efficiency even, that are worth taking into account specifically for professional environments.
Nicole.
Thanks. I agree with everything that's just been said, and I just want to call out the work of the Global CookSafe Coalition, who have been working with professional chefs to address this issue in their professional kitchens as well. So chefs are very, some chefs are very aware of the health and safety concerns of cooking with gas. So definitely keep an eye out for the work of the Global CookSafe Coalition.
For Armando and Laura, just an opportunity to chime in on that topic. Do you think that this is an area that has potential for cut through to get noticed more, that this isn't just a domestic issue, this is also a public spaces and occupational issue as well?
Laura, you can answer. My answer is short. I mean, I don't have a specific expertise on the topic, but I think that I saw some materials in the UK that I think that the team of Nicole was doing, and I like it a lot, the approach, because chefs now, they are a bit influencers, so not only they can help us to hide the voice, not just taking care of the conditions of the work of them, that's clear, yeah, but also take the advantage that many people is looking what they are saying, what they are doing, and this is affecting every day in the work of them. So maybe we could think some kind of activity or actions related with this. That is the first that is coming to my mind.
Thank you, Armando. Laura.
I would add only a few words about what Christine and Nicole said, and I totally agree with them. We have to remember that if you use traditional gas cooking, you have to clean them. You have to clean them completely, and the products that you use are full of organic volatile compounds. This kind of compounds are cancerogenic. So the use of this kind of gas cooking is a way to improve the use of toxic cleaners that are really toxic for the women's, but toxic for children too. And there are a lot of accidents of poisoning with those cleaners. And evidently, the organic volatile compounds is an added way of pollute the lungs of our children to all the others. I always, this is my idea, I always remember the cocktail of pollutants, because the effect of the cocktail is much worse than the single compounds. And it is not only an addition, 1 + 2 + 3. They are enlarging their effects if they are acting together. And volatile organic compounds are a very complicated issue to manage at home and at school.
Thank you, Laura. That's a really interesting point about that really there are potential co-benefits, additional benefits on top of just the transition away from having a gas cooker. An example being, yes, the gas cookers require more cleaning and the products used in them are more harmful. There are also, I'm sure, going to be other co-benefits as well for moving away. Nicole, I was wondering, as a member of CLASP's climate team, we've been very focused on health in this discussion so far, but there are going to be other good reasons to phase out gas stoves. It will be good to hear from you about some of the other problems or drawbacks or some of the other potential benefits that would come from a transition away from gas cooking.
Yeah, thanks, Richard. So one of the issues related to gas cooking that I think many people aren't aware of, as shown by some of our consumer surveys, is that is the actual energy used for cooking. Often you hear people saying that cooking with gas is quicker, it's easier to control, etc. The energy involved in heating up, say, a pot of water using a gas or an electric hob is quite different. But individuals looking to purchase a new hob aren't able to compare the energy consumption or the pollutant emissions from those products. There's no A to G energy label as we have for ovens, for example. So we've been conducting some product testing using the same testing methodology for gas, induction, ceramic, different types of technologies, which has shown that cooking with gas is actually far less efficient than any of the electric options. In fact, we've seen that it can use up to twice as much energy in some test conditions. Of course, the effect on consumers' energy bills depends on the relative prices of gas and electricity. But given general trends and intentions to electrify and adjust prices in favor of electricity over gas, and the inefficiency of gas hobs, gas cooking could become increasingly more expensive. So for this reason, CLASP believes that an A to G energy label for hobs is critical to ensure that people can make informed purchasing decisions. And I saw one of the questions in the chat asking about costs to upgrade to induction. Yes, it is a barrier to many households, and that's also why we're recommending incentives to support the transition to cleaner cooking, especially for those who are the most impacted and least able to make that transition. From an environmental perspective, it's also clear that the continued use of gas cooking will impact our European climate mitigation targets. Given efforts to decarbonize the electricity system, any electric hob purchased now would generate significantly less CO2 emissions than its gas equivalent. CLASP has done some analysis, and according to our estimates, implementing an energy label in 2025 and introducing product performance standards in 2029 that would effectively phase down the sale of new gas hobs we could see cumulative savings of 30 million tons of CO2 equivalent emissions reductions by 2040, with 85 million tons CO2 equivalent emissions reductions by 2050. So, what this tells us is we just really need to take action, not only to address the health impacts of using a fossil fuel in our kitchens, but also to tackle the environmental and potential economic impacts of cooking with gas indoors.
Oh, Christina, yeah.
Also, yes, thank you. I wanted to point out your own, but also while we're on the kind of broader considerations, picking up on something that Nicole mentioned, the general connection to the gas grid is something that we're also thinking about when we're looking at future trends, and the fact that people who are of higher socioeconomic status are more likely to disconnect and go use the clean electric alternatives for both heating and cooking, and then the cost of supporting the gas network itself is going to fall on those people who could not afford the upfront cost of switching to the clean appliance. And that is something else that we're concerned about from an equity perspective, seeing people live in more polluting environments and pay more for it.
Thank you, Christina. I suppose I'd like to ask an open question to all the panel, and you can answer this from your respective areas of specialism, which is really if this seems to be a fairly open and shut case. So why has nothing happened yet? And what do you think would be the really the cost of inaction, of not making progress in this space? It'll be interesting to hear how that resonates for you, not just in terms of economic costs and things like that, but also the cost to patients and families and communities as well. So I'd like to open that up to whoever would like to tackle that question first.
If I might just jump in, I think that mainly when we have been thinking about air pollution, we have been thinking about air pollution outdoors, because we have always considered our houses like our castles, our safe environment. So we were not aware that we had many other sources of indoor emissions that were contributing to our indoor air quality problems. So that was the first thing, is an awareness that indoor air pollution is also contributing to what we are breathing every day, especially because we spend indoors most of our time. What is true is that what it's outdoors, it infiltrates indoors. So many of the pollutants that we have in our houses are coming directly from the streets. So in terms of governments, it's much easier for them to sort of put several monitors or air quality monitors around several specific places and then control those environments, because it's much easier. You don't need to ask for permission to go into any other houses, right? But having said that, all the efforts that we have seen decreasing the concentrations outdoors, now it's when it's really becoming important that we also start controlling the emissions indoors. And we might think of different regulatory tools for doing that. So outdoors, we have emission controls for the cars, we have emissions for the industries, but we can also impact the indoor air quality of our houses using, for instance, sensors that can help us monitor the pollutants that we are emitting, but also with the building and regulation controls, with regulations like Nicole was saying, that you can sort of make appliances that have that their emissions are tighter, that we can inform consumers of between a different range of gas appliances or cooking appliances or heating appliances, what are those labels that will tell us that you have higher emissions here. Sort of, it has been really efficient in terms of electricity and energy use for the appliances. We have also seen the system of the labels that is working great for when you go to the supermarkets and you buy your food, so you can look at the less red or less orange, so you can inform, and that's very easy to be done if it's implemented. So we have, as a society, and the policymakers have done really good efforts in trying to control what is outdoors, but I think that now is the time to go also indoors.
Thank you, Joanna Maria. Yeah, absolutely. It's worthwhile emphasizing that there are a range of existing potential solutions that as a mix can be used to help address the topic, and that we can learn from how this has been addressed in other areas as well. Laura, could I turn to you and hear a little bit about what do you think of the cost of inaction, or why we haven't seen much progress in this space yet?
Well, I would say, firstly, this idea, because you have spoken about the co-benefits, and I'm thinking about this, hearing for Juana and Christine. If you can think that reducing fossil fuels emissions and use could be the first point to reduce both environmental pollution and climate change. And it's always the same thing to obtain two so important advantage. Well, we have to do immediately something, because on the other side, and maybe the something to do is the same, reducing fossil fuels consumes. What I can say is I'm thinking about 700,000 children at risk. And the children will be adult. And then we have new children arriving with the same problem. And we have only to do one thing, to reduce fossil fuel emissions. It's a so simple thing to do, even though it's not so simple for our governments. But the costs are enormous. I'm not able to count it, but you can think to the reduction of hospital admission, of drugs use. And you remember the puff used for asthma control. They are producing gases that are against our that are able to pollute our atmosphere. So reduced asthma can reduce the emission too from this point of view. It's a great amount of possibility of reducing costs. So we have to do something immediately, and it's only one thing: reducing fossil emission.
Thank you, Laura. Armando, could I put the question to you about the why you think there has not been enough movement in this space, and about the cost of inaction in this space?
Yeah, what we didn't have, some big movement on the topic. I don't know. What I can tell you is that when we talk about management of chronic conditions, COPD or asthma, for example, we have many things around. We are talking now about one specific topic, but one old patient with COPD, or one parent with one child with asthma, they have to manage many different things. Yeah. So we are not able to manage important things in COPD patients, like physiotherapy, rehabilitation, respiratory rehabilitation, mental health, yeah, access to early diagnosis, in child with asthma, the same access to early diagnosis, how to use the proper leading alerts, yeah, how to identify the triggers. So there are many things around, and sometimes people like me that we work on the front end of the patient's voice and patient advocates, we have some kind of experience, but then when we move to normal person living at home now, yeah, with COPD, there is a big gap, yeah, in the information, in the knowledge between researchers and some kind of policymakers, yeah, and the people. So I think I told you in the beginning, I mean, I see really high interest when we talk about the topic with the stakeholders. I think that COVID helped to put on the table this kind of problems. And we just need to identify the right data, scientific data, trying to really prove the direct connection with the situation and the clinical aspects, add some kind of economic impact and social impact. And I think that we are going to make some changes in the future. Sure, in the short term, I think that's my feeling.
Thank you for that assessment, Armando. Nicole, could I turn to you for sort of your final reflections on the potential cost of inaction here and what we want to see next?
Sure, yeah. So I think Christina already outlined in her presentation, you know, the impacts of indoor air pollution from gas cooking. We have clearly stated the societal health costs in our initial report, both to the EU and the UK, the impact on children, and I've just expressed the impact on the climate, as well as the potential economic impacts as well. The costs are just clear, and it's imperative that we do something sooner than later. Right now, there is nothing addressing the pollution emitted by these appliances. So we either need to see that the onus is placed on manufacturers to make sure that their products are not emitting these pollutants. We need to make sure that people who are looking to purchase these products are getting the information they need to make smart and informed decisions, say by clearly comparing the energy consumption of gas and other electric appliances on a label, as well as by providing some indication that these products actually emit pollution. It's the onus is on government to make that happen. So yeah, please take a look at our website for more information on all the potential impacts. Thanks.
Absolutely. Thank you, Nicole, for that. I'd like to hand the final word over to Christina before I wrap up this discussion today. Christina, could you say anything from EVA's perspective about what we would like to see next and about the cost of inaction here?
Yes, thank you, Richard. And I was honestly just thinking, what more is there to add? There's been such great reflections on the topic. I'm very grateful for the conversation we've had today. I think I've heard indoor air quality be called a regulatory no man's land, or maybe no woman's land. And it is true that it's a very complex issue, and maybe sometimes that's been used a little bit as an excuse not to tackle anything, where we do have some clear solutions. And Laura was talking about just fossil fuel emissions. That's one of the big ones, and it's a very clear target. And I think it's also a case of some of these discussions being taking place in a very technical environment where the health community isn't necessarily present and isn't necessarily always comfortable. And we're trying to fill that gap. We're trying to bridge that gap between the health community and the decision makers. And the manifesto is one of the ways in which we're trying to do that. So I'll end with another call for people to take a look at the website and consider signing the manifesto.
Christina, thank you very much for that. And I want to thank all of our panelists for their time and their insights today. I've greatly enjoyed the discussion. I hope that all of our attendees, our audience, have as well. So just to conclude for us all, we've heard today about the gas cooking releases harmful pollutants into our homes. so much so that they exceed the guidelines set by the World Health Organization. And that these pollutants, like nitrogen dioxide, they have been linked to a range of health conditions and impacts, including childhood asthma, and that there are enormous benefits and co-benefits in addressing this issue. And that there are efforts among the public health community to address this, including, as Christina has just reminded us, the manifesto, which you can find at cc4ph.eu. As we mentioned earlier, you can follow the future developments related to this area by staying in touch with EFA. So the recording of today's event will be available soon on EFA's YouTube channel. You can share and sign the manifesto, cc4ph.eu. And you can also find the CLASP study at clasp.ngo. And you can follow EFA's work to improve public health and reduce health inequalities on EFA's website, as well as their Twitter and LinkedIn channels. And with that, our event has come to an end. So I want to thank the team at EFA for their hard work for today, and to our really excellent speakers for their contributions. I want to thank Christina, Nicole, Laura, Armando, and Joana Maria. Thank you so much for your time today. And I would like to thank all of you for joining us today as well. Your questions have helped us explore this topic even deeper, and we really appreciate you being with us. So we're looking forward to seeing you all again at one of EFA's future events. But for now, thank you for your time today. We hope that you will share the manifesto with your colleagues and your partners, the class study also, and that you have a great rest of your day. Thank you very much. Take care. Bye.